Okay. It's been a great day, hasn't it? My mind is full, lots of notes, and I don't know how to sort this all out, but actually that's one of the things that you're going to help us do right now, at least in a little bit, which is to sort of bring, I'm not doing the summary. I hope you don't think that's what the agenda is. You're going to help me. You're going to help me with the summary. And we are, as George indicated, I am going to make sure that every roundtable member makes some sort of a summary observation that brief, concise, but that you see as useful to contributing to how we take these ideas forward. And after the roundtable members do that, we'll ask anyone else who wants to do that, but to give you a chance to make a few notes if you haven't already. If he didn't get you taking notes in the morning, I just first want to start by thanking a few people. Roundtable staff have been really incredible in putting something like this together. Alina Bachu, Lila Hernandez, Colin Fink, Drew Levernese, and then Rose Martinez, who runs the board of population health that we're under. I mean, it's exceptional work, and we couldn't do this without someone else to recognize that. And also the roundtable leadership that put this together. Pam as the planning committee chair, other members of that planning committee, and those members that were facilitators here, Dawn, Jim, and Phyllis. So let's give them a round. I twisted Pam's arm a little bit to take on this job when we had to get going with this next thing, and we were a little bit behind, and she really came through. But you've really set a standard for. This was an exceptional workshop. The way you put it together, you set a standard for the next people that have to do that, and it just happens that I'm the next one that has to do it in December, so I'm in awe of that. So, okay. We're going to go through this little exercise. These will be recorded and in some way, become a part of our workshop summary. So reflecting some of the conversations, I was just chatting with Alina in the back. We will do this now and it's useful, but these discussions, just like the one we just had, are so rich that we need to capture that adequately as well. So we look to people for their observations, just in case you're intimidated by this. If somebody else said your idea, it's okay to say, I second that, but I would ask you to sort of put your own spin on it a little bit about why that was your first choice. And if you want to repeat a comment or question that you made during the day to sort of drive it home, which I may do, that's okay too. So anyway, I'm going to open the floor. I'm not going to call on names, but I'm going to keep track of who's. Probably would be good. Or we can pass a mic around. Actually, I think we can pass a mic. Or what? We got Mary at a mic. So
yeah, there we go.
While she starts
How's
that,
that?
we'll also
Add a
be
mic.
able to pass around a mic to people that raise their hands. So I'm going to start with Mary, and then I'm going to go in the back row.